Family planning is one of the most cost-effective public health interventions there is. Allowing women to have the choice of when and how many children to have is totally fundamental to reducing infant and maternal mortality. It also helps achieve financial stability for families, achieve national development economic goals. The impact on women's empowerment far beyond just maternal mortality rates is really enormous. And so that's really why CHI got involved in family planning. And there's really good evidence that as you make more methods available, more women choose family planning. There are a number of benefits to long-acting methods. And so when I talk about long-acting methods, I'm referring to implants and intrauterine devices, what we call LARC, long-acting reversible contraceptives. We were really excited when we started hearing from our country teams, hey, there's contraceptive implant, women really seem to want it, the price is too high, what can we do about that? And I think that really demonstrates how CHI works, and that the problems and the issues to be solved are generated from the ground up. And that's really what led to the price reduction agreement for both McDowell and Implanon that our global markets team helped achieve together with the Bill and Melinda Gates Foundation, DFID, USAID, bringing together a coalition of people with the manufacturers to say, look, there's demand for this product. If we can tell you what that demand is, will you give us a better price? And let's put that in writing and make sure that all of the developing world can have access to that price, and so that we can reliably scale up implants. That price reduction agreement brought the cost down from $18 to $850 for the purchase price. Following the deal, we wanted to make sure that those implants actually made it to the women who needed them. We focused on setting up national scale-up plans. How many health workers needed to be trained? How many service delivery outfits were there? What was the actual demand for the product and where? And once we were able to kind of quantify those things and look at the resources in the country and match those up with the needs, we were able to get a much better picture nationally of actually, scale-up was really possible. We took a pretty heavy analytical approach, like I said, to tracking consumption and mapping out where health workers were being trained. But we did all of that through national data systems. And building the capacity at the national level, at the subnational level, to both make sure that that was accurate data and make sure that that data was being used. We were able to do that, and of course partnering with a number of different partner organizations, donors in these countries, through big coalitions, again under the leadership of the Ministry of Health. And about 2.5 years out now, in our focus countries, we've about tripled consumption. So in Nigeria, one of the things we've been able to do is work with the State Ministry of Health in Zamfara. What we do is we help them coordinate with all the different partners doing training and service delivery activities in the state. Where are the needs for trained providers the highest? Let's direct training resources there. And then we follow up and we track where those providers are, and we make sure that the supply chain is properly serving them. So it sounds simple, and it is, and just doing that, we've been able to double consumption of implants in the state in a year. And it's those kind of common sense management approaches that just need some organization and coordination, pulling together different pieces and making that link between service delivery and logistics, improving that communication and making sure you have both the human resource capacity and the commodities to provide the service. This is a state that has less than 10% of its women using contraceptives. And I think by showing this rapid increase in consumption, we can see the demand is there, and it's our job to make sure that the services are there to meet that demand and see that percentage rise.